antituberculars, antifungals, peptides, and metronidazole. Tuberculosis is a mycobacterium, and it can be caught via droplets through coughing and sneezing. Patients at risk are those who are debilitated, alcohol addicted, immunocompromised, people with AIDS, people living in small quarters, like in jail cells. Symptoms include cough, sputum, fever, night sweats, weight loss, GI distress, a positive acid-fast bacilli in the sputum. That's the lab that we send down to confirm it. Prophylaxis is recommended. We don't want close contact with a diagnosed TB patient. HIV positive with a positive TB skin test calls for prophylaxis. Prophylactic treatment also should be given when someone has converted from negative to a positive TB test. It is contraindicated in liver disease because of the properties of the drugs that are so harsh on the liver. So single drug therapy is really ineffective on tuberculosis, so multi-drug therapy is used. A couple of drugs usually in prophylaxis and up to 6 drugs in active disease. Multi-drug therapy decreases bacterial resistance to the drug, and treatment duration is decreased. So then we move on to talking about the actual drugs. The first-line drugs that we use for anti-tubercular treatment are things like isoniazid, rifampin, rifabutin, rifampicin, and pyrazinamide, ethambutol, streptomycin. They're more effective than the second lines, and they're less toxic actually than the second line drugs. So a lot of the mycins can be used as second line, but oftentimes you'll see isoniazid and rifampin used for prophylactic treatment. So those are the two that we talk about. So side effects and adverse reactions with anti-tubercular drugs, and in particular we talk about isoniazid, include peripheral neuropathy, which is a really big issue. And so people are also prescribed vitamin B6 to help with that and decrease that risk of peripheral neuropathy. With isoniazid, rifampin, and streptomycin, we have this issue of hepatotoxicity. So isoniazid, rifampin, and streptomycin all include headaches, blood dyscrasias, paresthesias, GI distress, and ocular toxicity. Rifampin, a harmless thing that rifampin does, but you still need to let patients know because it kind of makes them worried. It turns their body fluids orange. Now this will stain their clothing, so they need to know that. And they also need to know that this is temporary. It's just while they're on the drug. So side effects and adverse reactions of ethambutol include dizziness, confusion, hallucinations, and joint pain. Streptomycin, along with other mycins, include problems with ototoxicity, optic nerve toxicity, encephalopathy, angioedema, CNS, respiratory depression, nephrotoxicity, and hepatotoxicity. So there can be 2 phases. There are usually, the treatment is divided into these 2 phases. The first one is within the first 2 months, and the next one is the 4 to 7 month period. Isoniazid is either oral or IM. It inhibits bacterial wall synthesis. Side effects and adverse reactions include GI distress, constipation, blurred vision and photosensitivity, tinnitus, dizziness, peripheral neuropathy, psychotic behavior, seizures, blood dyscrasia, and hepatotoxicity. Hepatotoxicity is big when it comes to these. So with isoniazid, it increases the effect. So isoniazid itself has an increased effect when it's taken with alcohol, rifampin, cycloserine, or phenytoin, and it decreases that phenytoin effect. Antacids decrease the absorption as they do with most antibiotics. Alcohol increases the risk of neuropathy and hepatotoxicity. Patients would want to take isoniazid 1 hour before meals or 2 hours after meals. They must follow their complete regimen, collect sputum specimen in early morning, take pyridoxine to prevent peripheral neuropathy, check liver enzymes frequently, monitor CBC. They need frequent eye exams. They should report numbness, tingling, burning, and teach sun precautions to avoid, and also you should teach them to avoid antacids. Those should really be two different lines. Streptomycin, two major things. You want to monitor ototoxicity and monitor renal function. With rifampin, a big thing, obviously, with all of these liver problems can be seen, but you also want to warn the patient that body fluids may be reddish orange. Ethambutol, you want to let people know that they need to take a daily dose to avoid just that single daily dose to avoid visual disturbances.